The Rural Health Medical Program is a federally qualified health center, also known as a community health center, that provides preventative and primary health care services across 6 counties in the Black Belt region of Alabama. We service those individuals that are faced with some of the largest socioeconomic barriers across those 6 counties that we serve.
So Information is Power is a program that's open to all, which is great, and it's very low cost. It's definitely lower cost than the commercial labs run. And a lot of insurances don't cover genetic testing. Even if they have a family history, if it's not this specific family history they're looking for, they may not cover it. And so this program allows them to get genetic testing either free if they're in a certain age group or low cost.
We're placed in areas where there's a limited number of primary care providers. Our goal is for them not to travel more than 15 to 20 minutes to provide primary and preventative healthcare services. Through collaborations and partnerships, we've been able, with the HudsonAlpha Information is Power program, provide genetic testing to that population. For these individuals in these counties, this is an essential service. It allows them to know where they are in their health journey. It allows them to seek preventative care. And if they do experience a mutation that is designated to one of these cancers that the program is interested in following, we're able to connect them to immediate care.
So I think there's various benefits to Information is Power for our community. Of course, number one is for patients to find out if they have a mutation that would put them at risk for increased risk for cancers. But also, there are a lot of patients that don't know their family history, they're adopted, so they don't even know if they're at risk or not enough to go ahead and get genetic testing. So Information is Power gets that word out there that it's important to find that out. A lot of people, even if they don't have a family history, may have a mutation. Also, it's taken away the stigma of learning about having one of those mutations. So a lot of patients used to really not want to know if they had a gene. They were worried that insurance would discriminate against them, and you have to keep re-educating, and you guys have really helped re-educate the community on that.
Having partners such as HudsonAlpha through Information is Power has allowed me as a leader to add another layer of care to what we do here at Rural Health Medical Program. We're able to also enroll patients in lifestyle choice programs such as our type 2 diabetes program or women's health, but now also getting to genetic testing to identify if you, and if you're a mom, if your child would potentially have a cancer trait that you can prevent or do lifestyle changes to prolong their life.
I've devoted my life to women's health, and I have 3 daughters myself, so it's very important to me that women have the ability to get that kind of information and use it and actually have something they can do about it. Before we didn't even know which genes increased by which percentage, and now we have a lot more data, and that really helps them narrow down what they need to increase their testing for.